All right, so if I don't hear anything more in the background, let's move on. Ooh, look at that. All right, many muscles. And so today I'm going to do, I think, hip and probably thigh, and then we'll see where that goes. Probably not the knee movers yet. Then we'll do knee movers and ankle movers on Wednesday. Many muscles originate from around the pelvis. One of them reaches from the sacrum to the greater trochanter, which, when it contracts, the femur gets pulled backwards, which rotates the foot outward. Can you name that muscle? Anybody?
Piriformis.
Piriformis. Very good. So let me show you on this here. So we have, oops, I want to bring this over a little bit more, maybe, or slower, smaller. There we go. So the piriformis attaches to the sacrum, actually on the inside. I don't have a picture that shows it. It goes on the inside of the sacrum, goes out to the greater trochanter. When it contracts, it sort of rotates the femur this way. So it, like, what it actually does, it turns your foot outward. Okay? So when you, why, oh my Lord, can I just make me alone here now? Nah, never mind. There we go.
Right.
There we go. I was thinking. So you can see me in the screen. It's a little harder to do these lower back muscles. So let's see. So the muscles attached. Yeah, you can't do that. Never mind. Can you see it on the picture? What that muscle does?
Mm-hmm.
Okay, good. So yeah, here you have another shot. You see, so how it pulls this way, and when it pulls, it brings that outside thigh to the outside and rotates it. The other thing you can see here is, see that right, the yellow thing here? That's a sciatic nerve, and that goes underneath that piriformis muscle. Very often that gets pinched, and they call that then sciatica, and because of the piriformis syndrome, they mentioned that like that. If you ever had, you know, shooting pain down the back of the leg, then that's kind of what you're possibly dealing with. All right, so that's a cool muscle. You got that?
Yep.
Another set anchors around the crest of the ilium and the external iliac fossa and reaches to the greater trochanter and even further down the thigh to the outside via the knee, via the IT band. Those muscles pull the leg outward, as in abduction. Can you list the ones that accomplish that from this list? Anybody?
Gluteus Maximus.
Okay.
Tensor, Fasciae, Latae.
Very good.
Gluteus Medius.
Very good. Those three last ones there. So when I look at those, I have some of them right here. Actually, they're all kind of right here, pretty much. I got this big one back here is the Gluteus Maximus, and that goes into the back of the thigh here a little bit. See that here? That anchors into there. But then it also reaches all the way down see here, into this band here, this white stuff, that then goes all the way down towards the knee, that white stuff. That's called the Iliotibial Band, because it goes from the ilium all the way to the tibia. Although the funny thing is, it feeds into the fibula, but they still call it tibia, Iliotibial Band. And so that's the Gluteus Maximus is the one muscle. Then here, the other one you see nice is the Tensor Fasciae Latae. You see, it's a small muscle that starts in the front of the hip, like that, where the ASI is on the side, right on the side of your hip in the front, and goes into that IT band. And so you can imagine when both of those muscles contract, they bring that upward, and that brings the leg outward. Can you visualize that? Can you visualize that?
Yep.
Good. So when it pulls on here, it brings the thigh out. The other one that is interesting here, the other Gluteus Medius, and actually the minimus also, but the minimus wasn't on the list. That's right here. That muscle is caught right here, and here you can see it as a full length muscle right here. So you can see how it goes from the crest into the greater trochanter. And what you can see over here is just the minimus going into the greater trochanter. And they also, as you can visualize, when they contract, they will bring that thigh outward again, like that. And then the other thing that the gluteus medius does that's interesting is when you walk and you lift one leg up and your hip stays level, the medius on the side of the thigh that is standing on the floor is contracting, because if it's not, your hip will fall down on that other side when you lift that leg because of the gravity going down. Does that make sense?
Yeah.
So when you see somebody waddle, very possibly their gluteus medius is not strong. And then that, often gives excessive motion here. And then you start having ouchies because, too much stuff happening in that area compared to when you just keep it contracted. All right, so that's that. Enough clinical of that. In front is a set of muscles that help us lift the thigh up. One of them originates from the anterior part of the lumbar spine, which is very deep. That's behind your gut. So you got to reach really deep. You can feel it, but you got to know where to look for it. And then it has a cousin, and the cousin of it anchors in the front of the ilium. That one's easier to feel. That one you could go to the front of your ilium, and you put your hand into it, and you can feel it there. I guess that doesn't make sense. But and then from there, both of those muscles go down and wait, where's that? Fingers as they slide up and down, and then those muscles both go down and feed deep into the inner thigh, right where the pubic symphysis is. So very high up there at the lesser trochanter. What muscle am I talking about?
The Iliopsoas.
The iliopsoas, correct.
Iliopsoas.
Very good. And that iliopsoas is right here. So you see that here. This is an eye shot. You see how it's anchored into the spine here, and then it reaches down and goes right there into the thigh. It's very deep to palpate. It's not easy, but it's a very effective muscle. And then the second one goes from the iliac fossa here and reaches down also into the inner thigh by the lesser trochanter. This is a good way to stretch that muscle, because when you sit a lot, that muscle gets tight a lot, and that muscle causes a lot of back pain. I always say the sore ass gives you a sore ass. That way we don't forget, because it's what we miss. It's like, oh, my back hurts. And maybe it's like you didn't stretch the front of your whole thing. Because if there's not, when you have your thigh always up because you're sitting, this is always contracted a little bit or shortened. Anyway, that's the psoas for us. Very important muscle. Very, very, very tight in a lot of people. So doing lunges is very good. Let's now consider the muscles around the thigh. If we group them broadly, we can make out three sets. One in front, one on the side, one in the back. The muscles, one in front, one on the inside, and one on the back. The muscles in the back group will mainly occupy themselves with bending the knee. What are they collectively called?
Your hamstrings.
That's the hammies. So the hammies is an interesting muscle group. So there's four of them. There's two that go to the outside of the knee and two that go to the inside of the knee. And they're all attached. Well, actually, three of them are attached on the sit bone, facial tuberosity, and then one is attached to the thigh in the back. And if you visualize when they contract, when it shortens, they're going to pull that knee up and bend the knee. So you can stretch them this way. And they're probably fairly important to be stretched because they're usually tight in people and they can tear, especially when the glutes up here are not so strong and then the low back muscles up here are maybe not so strong. Run. Let's say you run, you bend your knee and you push up, the force goes in the hamstrings and then you extend your thigh, and so you use your glutes to pull that up more, and then it goes into the low back by yanking the whole hip upward a little bit. If any of those elements are weak, you gotta have a problem, and often the hamstrings is where we get injuries, especially for sports like baseball where you gotta stop and run, stop and go a lot of the times. So that's an interesting one to remember and to stretch before you do weekend warrior type exercises. So after a lot of sitting, you want to stretch that one out. The same with the calf. You also want to stretch the calf one The group in the front of your thigh are the most powerful muscles in the body. They straighten out the knee. These muscles are holding our bodies upright against gravity and by keeping the knees from buckling. Can you list the names of muscles that make up this powerful group?
The Vastus Intermedius, the Rectus Femoris, and the Vastus Medialis.
Very good. And Rich, there's one more that makes up the group that's not listed. Can you remember that? It's the Vastus Lateralis.
Oh, that's right. That's right.
So we have this group, which is an interesting. It's actually interesting because this group is attached. Not all of them, but a lot of them are attached to the linea aspera in the back of the thigh, and they reach around. They reach to the front, and then go into the knee, right below here,
Okay.
the tibial tuberosity. So first they go through the patella. That's why we got the kneecap, and then they go into the tibial tuberosity where they anchor in. So you can see this is a cross section right here. So you can see how thick the back is. Yeah, all this red stuff is rectus. I mean, is quadricep muscle. All this red stuff. So the vastus lateralis and the vastus medialis come all the way from the back and reach around, and then the vastus intermedius is starting on the front of the thigh, and then on top of it is the rectus femoris, and that one actually starts all the way up by the hip and goes down to the knee. So that rectus femoris muscle doesn't just straighten the knee out, but it also helps with pulling the whole thigh up to the hip, flexing the thigh, which was the work of this muscle right here. So the Iliopsoas, I know this is a little deep, but the Iliopsoas and the rectus femoris work together. So if you evaluate for injury prevention type stuff, you want to make sure this muscle is not too tight. It's stretched enough. So often bringing the knee, bending the knee and bringing the foot up in the back or sitting on the heels, it's good to stretch that muscle. All right?
Right.
Any thoughts, any questions, any comments?
The next one I haven't been able to get right, so I just waited for class.
Let's see how that goes. Onwards to the massive muscle group that concerns itself with pulling the thigh medial as an adduction. It makes up the thigh's medial muscle group. They are strong lateral stabilizers, which means if you say lateral stabilizers, I mean if you do, you go side to side, the medial muscle makes sure you don't fall out to the outside. They pull medial. So they're really strong. Like I had one football player, he did a lot of zigzag running, and those muscles were needing to work on him. Anyway, lateral stabilize so we can stand, walk, and run without falling over. Visualize yourself running zigzag. Understand their massive jobs. Good. Can you name the muscles that make up the group? Oh, that is a nasty question. Anybody?
I got it wrong.
So we got adductor, longus, and the only other one I got is gracilis. Let's go through all of them. So let's go through the ones that are making up these adductors here. Massive group. So here are the adductors. Adductor brevis, adductor longus, adductor magnus. So that's actually really nice if you have muscles that have the same name like that. And in the test, you don't need to worry about labeling all the different ones. You just have one group. And then the gracilis. But the colors show you, right? The adductor, they start in the back of the thigh and go either to the pubic bone in the front or to the sit bone in the back. So the adductor, I think the pectineus, which is the top one right here, a small one, adductor, longus and brevis, and gracilis, but all go to the pubic bone. And then the adductor magnus goes to the ischial tuberosity. Actually, this might be a little bit wrong the way it's drawn. But that's okay. We don't have to worry about that. So let's see the ones on that list. So we have pectineus, adductors, gracilis, and magnus. So let's see what was on that list. Quadratus lumborum, that is a low back muscle. Semitendinosus is one of the hamstring muscles. And sartorius is the talar muscle. It's a very superficial muscle like here. It starts from the tip of the ASIS and goes all the way on top of all the thigh muscle, all the quadriceps, and goes to the inner tibia inner knee there. So it's called the talus muscle because it sort of does the motion that brings the one ankle to the opposite knee. So it crosses over the leg. That's kind of the motion it does. I should say that crosses over the leg. That will make it easy. Okay. All right. Then we can from there we can move to the calf. Although I have one more here.